that's about it.
Oh, excuse me. Good grief.
Oop.
All right. I got to punch back in. Sorry,
you're
I'm gonna put
late.
my phone on.
So go ahead, Cheryl, take it away.
Basically, it's everybody mute their microphones while the speaker is speaking, and write down any questions you might have so he can answer them. And welcome everybody. And I'm glad to be here. I was originally not supposed to be on, but because we're going over to Windsor, but to celebrate my birthday today. So
Yay,
Happy birthday.
thank you.
Yes, happy birthday. I think Jan mentioned birthday to you on Facebook.
Yeah, I saw that.
And Dorothy just
Nice.
popped in too. All right. Hi, Dorothy.
Dorothy.
And you made it just before I introduced our speakers. So
Oh,
you came
good.
just in time.
Good
So, hi,
deal.
everybody. I'm the president of the Metro Fibromyalgia Support Group. This is Dr. Howard Schubiner. He's going to be speaking to us today. He spoke to us many times in the past, both in person and on Zoom. So take it away, Dr. Schubiner, and thank you for speaking to us today on Zoom.
Thank you. Yes, I have spoken to this group many times. I have a warm place in my heart for this group. And I'm sure people come and go and change over time. I don't know how many of you have heard me speak before or not. You know?
I have. I've taken I was in your class actually.
Right. Okay, good. Good. So basically, there's things that I've been working in this area for 20 years. And what we've learned is that sometimes simple observances can make a big difference in how people understand things. For example, everyone thought the earth was flat because when you saw the earth, it looked flat. We didn't have spaceships or rocket ships hundreds of years ago to look at the earth from space. So people didn't know if it was flat or round. But somebody noticed that when a ship comes in from the ocean toward land, when you see the ship coming toward land, you don't see the whole ship, you see the top of the mast first. And as the ship gets closer to land, you start seeing the ship from top down. Well, the reason for that is that the earth is round. So if the earth was flat, you would see the whole ship at the same time. You wouldn't see the top first. And I think that's really a brilliant observation that somebody made. And it was a simple thing. You don't need special instruments or technology to make that observation. In medicine, sometimes simple observations are made, which can make a big difference. There was a doctor from Austria in the 1850s who was delivering babies, and there were babies being delivered by the doctors, and there were also babies being delivered by the midwives. And he noticed that the doctors, more of the women who were delivered by the doctors died than women delivered by the midwives. That seemed odd. So he was just observing what was going on. And it turned out that the midwives took more time between the deliveries. The doctors did one delivery after another after another. They went from one woman to the next, delivering their babies. And the midwives took time in between. And the midwives washed their hands between deliveries. And he thought, that's interesting. I wonder if washing hands would make a difference. Now, they had no ideas about bacteria back in that day. They had no idea that bacteria even existed or viruses. But he noticed that washing hands seemed to be correlated with fewer deaths. So he did an experiment, and I don't know exactly how he did it, but he took half the people and he made them wash their hands, and the other half, they didn't wash their hands. And he found that the people, when the doctors or the midwives washed their hands, they had less deaths than when they didn't wash their hands between deliveries. So he concluded that hand washing saved lives. So how do you think that information was taken by the medical profession in the 1850s? How do you think they looked at his discovery? They ridiculed him. They completely ridiculed him, and they never accepted his findings, even though it was obviously science-based. If you wash your hands, you have fewer deaths. They didn't know why, but that's what they found. And he ended up dying in an insane asylum. They never accepted his ideas. And then, 50 years later, people started understanding bacteria, and then they had a reason for why washing your hands makes a difference. Because what they were doing is they were giving bacteria from one woman to the next. They were introducing bacteria. They were making it worse.
Wow.
Okay. So in the field of pain, there's a standard view of what pain is. The standard view is that pain is caused by tissue damage in the body. That's what everyone knows. That's what everyone thinks. But it turns out it's wrong. And the reason it's wrong, from my point of view, is from very simple observations. Number one, you can have an injury and have no pain. Thousands and thousands of descriptions and documentation of people who have had injuries and had no pain. People have had nails in there. I have a friend who shot a nail in his hand and had no pain. Dr. Beecher in the 1940s studied soldiers on the battlefield, and they had injuries. And when they got to the medical tent, he asked them, "Sir, soldier, are you in pain?" And 2/3 of them said no. So 2/3 of the people that had injuries had no pain. And there's just thousands of examples of that. So if you accept the fact that it's true that not all injuries cause pain, that brings into question the idea that all pain is due to an injury. There's got to be something else going on. If you can have an injury, a nail in your hand, a bullet in your stomach, and have no pain. So there's another observation that we made, and that is that not all pain is due to injuries. So you can have pain, real pain, severe pain, and have no injury at all. We know that because there was a guy who stepped on a nail. The nail went all the way through his boot in Britain. He had severe pain. They rushed him to the hospital. They took his boot off, and the nail was between his toes. There was no injury at all. So if you take those two simple facts, that not all injuries and you can have an injury with no pain, and you can have pain without an injury, then you have to decide, you have to throw away the conclusion that pain is due to an injury in the body. It's not. Pain is due to the brain creating pain. Now, the brain will create pain if you have an injury most of the time, but not all the time. So if you get a cut, chances are you'll have pain. If you put your finger on a hot stove, chances are you'll get pain. But the point that I'm making is that the reason you're having pain is not due to the finger. A finger cannot cause pain. Only the brain can cause pain. And now we have neuroscience that documents that, because neuroscience tells us that we don't see with our eyes. We see with our brain. Our brain creates the images that we see. How do we know that how do you know that the brain creates images? Because you can see in your dreams. Your eyes are closed when you're dreaming, but yet you can see. So our brain has the capacity of creating images. And it turns out that our brain often gets it wrong about what comes in our eyes. If you have somebody who saw a crime and you bring them into the police lineup and the police says who committed the crime, they will point out who they think committed the crime, and they will be wrong most of the time. Research shows that they'll be wrong most of the time. Why is that? Because our brain doesn't see exactly what our eyes see. And our brain generates images that, it's doing the best it can. It turns out that some people, everyone has preconceived notions about everything. And people have preconceived notions about what criminals look like. And chances are people will pick out somebody in the lineup who looks like a criminal to them, even though it might not be the person they saw. And that's research has shown that. When people, if I gave you prism glasses that turn the world upside down, you would see everything upside down for a day or two, and then your brain would turn it right side up again, because your brain controls what you see. Our brain controls what we hear. Have you ever heard your name being called when it wasn't? Of course you have. Have you ever heard something that was completely different than what the person actually said, because your brain just changed it around? I was at a meeting a couple of years ago, and a woman got up and said, "Good morning, America." Seemed like an odd thing to say. She actually said, "Good morning, I'm Erica." But I heard, "Good morning, America." And these things happen all the time. And what we feel is generated by our brain. My wife has the same breakfast every morning: sliced apple, yogurt, granola. And one morning she had an extra slice, and she brought it up to the bedroom and she fed it to me. It was dark. I didn't see it. I didn't touch it. I just bit into this apple, and I got a rotten taste in my mouth. Why would my wife give me a rotten apple to eat? She wouldn't do that. It turned out she had a peach that day rather than an apple. But my brain was expecting the crunch of an apple, and it got the softness of a peach. Now, our brain has a danger signal center. This danger center is there to alert us. If you break an ankle, the brain will turn on pain to alert you that you have a broken ankle. If you eat something rotten, the brain will give you a rotten taste to alert you that you ate something rotten. In this case, my brain was expecting the crunch of an apple, and it got the softness of a peach. I love peaches, and the peach was sweet. Why did my brain give me a rotten taste in my mouth? It was a mistake, right? It was an error. My brain made a mistake. But it was doing it to protect me because it had a choice. And it only has a millisecond to decide, is this a rotten apple or a sweet peach? What would be better for the brain to choose if it wants to protect me? A rotten apple. It was protecting me. If it was a sweet peach, no harm done. But if it was actually a rotten apple, I would spit it out and I would be safe. I would be, better off. When women are pregnant, their brains increase the amount of sensitivity they have to bad taste. Because when women are pregnant, they're more at risk. And when women are pregnant, their brain wants to protect them more. And so their brain is going to make them make them more sensitive to different foods that might be dangerous. Are you with me? Our brain controls what we see, what we hear, and what we feel. And not all injuries cause pain, and not all pain is due to injury. So what would cause the brain to turn on pain? If there's an injury, the brain will turn on pain to protect us from the injury. Why would the brain turn on pain if there's no injury? Why would it do that? To protect us. It turns out, and research shows, that when you give someone a physical injury and you scan their brain, you'll see certain parts of the brain lighting up. If you give someone, that's with a physical injury, right? If you give someone an emotional injury and you scan their brain, the same parts of the brain light up. So it turns out that a physical injury can cause pain, and an emotional injury can cause pain. And the pain is the same, whether it's caused by a physical injury or by an emotional injury. It's the same because it's all produced by the brain. All pain is created by the brain. All pain is real. And there's no such thing as imaginary pain because all pain is the same. The question is, what's causing it? Is it caused by a physical injury or an emotional injury? In November, my hospital I went into a meeting with the head of my practice plan at the hospital, at Providence Hospital, where I worked for 20 years. And they told me they were not going to renew my contract after 20 years. They were letting me go. That was an emotional injury. It was not a physical injury. But 2 days later, my back started to hurt. Why did my back start to hurt? Because my brain was unhappy. I had suffered an emotional injury, and my brain was sending me a warning signal, even though, and it wasn't sending me a warning signal that I had injured my back. It was sending me a warning signal that I had injured, my life. And how was I to know whether this pain is due to a physical injury or an emotional injury? How was I to determine? Do you think it's important to determine if if a pain is due to a physical injury or an emotional injury? It's pretty darn important. Because if I go to the doctor with back pain and the doctor thinks I have a physical injury, they're going to give me physical treatment. But if I don't have a back injury, why would I want physical treatment? It's not necessary. It's not appropriate. And it possibly could do me harm. What if the doctor looked at my MRI and saw bulging discs and degenerative discs? Do you think that's possible?
Yeah.
It's not only possible, it's 100% likely, because I'm 70 years old. I'm 71. 95% of 70-year-olds who are healthy and have no pain have degenerative discs and bulging discs in their back. He might as well say, well, I looked at your hair and it's gray. And I would say, well, is that a disease? And you say, well, do you have head pain? Do you have pain in your head? And I said, no. He said, well, then it's not a disease. If I had headache and he had said your head pain is due to gray hair, what would you say? You'd say, that's ridiculous. That's gray hair. It only hurts if I look in the mirror. Right? But doctors do the same thing every day with people who have bulging discs and degenerative discs in their spine, because those are due to graying of the spine, aging of the spine. Those things don't cause pain, yet doctors are telling people those are the cause of back pain and neck pain all the time. We just did a research study where we evaluated 222 people with chronic neck and back pain. And we evaluated them using a method that I'm going to explain to you in a second. And we found that 88% of the people with chronic neck and back pain did not have an injury in their back. 88%. If those same people had gone to a regular doctor, they would have said 98% it's due to an injury in their back. And we found the opposite. Why did we find the opposite? Because we looked more closely. How do you look more closely at someone who has pain? You use common sense. My pain didn't start with an injury. It started a physical injury. It started with an emotional injury. Okay. My pain hurt in the lower back, but it hurt when I was lying down. And it hurt when I was standing up. But then sometimes when I was lying down, it didn't hurt. And sometimes when I was standing up, it didn't hurt. In other words, it was inconsistent. Well, if you have an injury, the pain would be consistent. It wouldn't come and go. The pain sometimes was a itching, and sometimes was a burning, and sometimes was an aching. Why would that change? Just thinking, use common sense. The pain was worse when I thought about my job. Why would that happen? Common sense. So what we did and we have all these criteria that I've written about in my book. So we took these criteria that are called the FIT criteria. Is it functional? Is it inconsistent? And is it triggered? When pain is triggered by the weather, that's pain caused by the brain, not caused by the body. When pain turns on and off, that's caused by the brain. When pain shifts from one part of the body to another, That's caused by the brain, neural circuits in the brain. These are all real pains, not imaginary pains, but they're not caused by physical injury because it's the same reasoning as why do you see the top of the mast when the boat comes toward you? Just common sense. Fibromyalgia, typically the pain shifts from place to place in the body. Fibromyalgia, typically the pains turn on and off. Fibromyalgia, typically the pains are triggered by sound or light or stress or the weather. All those things happen typically in fibromyalgia. Real pain can be generated by the brain. And what I do in my work is I explain how the brain works to people, just like I just explained to you guys. And then we assess on an individual basis. Tell me about your pain. Does it ever shift or move or turn on or off? Is it triggered by stress, triggered by the wind, by cold, triggered by light or sound? Have the doctors been able to find something that is causing the pain? Have they found lupus or rheumatoid arthritis, something like that, or not? Have they found degenerative discs and bulging discs? If they have, that's irrelevant because everyone has those. 50% of 30-year-olds have degenerative discs who have no pain. It's not just old people who have degenerative or bulging discs that are normal. Even young people have them. So we do that assessment. We do the education, the assessment, and then we have 4 methods for helping people turn off the neural circuits for pain. The first one is called PRT, pain reprocessing therapy. I'll explain that in a minute. The second one is called emotional awareness and expression therapy. I'll explain that in a minute. The third one deals with if people need to make any changes in their life. For example, if someone is having head pain or back pain or stomach pain or fibro pain every day, that's better when they're on vacation and worse when they're at home, or better when they're at home than worse when they're at work. Maybe the job is causing the pain. So sometimes people need to change their job. Sometimes people have situations in their life that are toxic. Sometimes people have children who are mean or cruel or demanding. Sometimes people have parents who are mean, cruel, or demanding. Sometimes people have sisters or brothers or relatives or neighbors who are mean, cruel, and demanding, or whatever they do. And sometimes we need, as human beings, to protect ourselves. And the brain is trying to protect us, but the brain can't speak English and say, you have to build a fence between you and your neighbor. It just gives you pain. It's up to us to figure out what we need to do. So sometimes people need to make a change in their life. And the fourth treatment that we have is evaluating how people treat themselves. It turns out that a lot of people with chronic pain are unkind to themselves. A lot of people with chronic pain are harsh to themselves. A lot of people with chronic pain are overly perfectionistic, feel guilty, try to do everything for everybody else except for themselves. They tend to not be assertive or not say no. They tend to just let people walk over them. They tend to, take all their feelings and hold them in. Never express their feelings. Never stand up for themselves. And I'm not saying this has anything to do with any of you, but this is a common thing that we've seen. So sometimes people need to change how they treat themselves. So those are the 4 treatment methods: pain reprocessing, emotional awareness, evaluating our lives for any changes that need to be made. I saw one woman who had severe amounts of pain, severe amounts of migraine, fibromyalgia, irritable bowel, anxiety, depression, and she needed to leave her husband. Well, when she did that, she started getting better. I'm not saying you guys have to do that, but it happens. And the fourth thing is how people treat themselves. So back to the first thing, pain reprocessing therapy. And this is all in my book, in my books. Pain reprocessing therapy is changing the relationship you have to the pain. When people view their pain as being due to damage in their body, then they're going to be powerless over it. There's nothing they can do about it if they believe that it's due to damage in their body. They'll just have to cope with it and do the best they can. But if it turns out the pain is due to neural circuits in the brain, then the treatment is different. Not to take medication or do surgery or injections. The treatment is to change your relationship to the pain. And that means to decrease the amount of fear and worry about it, to decrease the amount of focus and attention on it, to decrease fighting it, to decrease being frustrated by it, to decrease trying to fix it, and to decrease trying to figure it out, but rather to treat it as a harmless signal, like a smoke alarm that goes off. If there's no smoke, you don't have to worry about the sound. It's just a smoke alarm. And so that's, in a nutshell, that's pain reprocessing therapy. And there's a lot of techniques for how to do that. The other treatment I haven't talked about yet is emotional awareness and expression therapy. And these therapies, by the way, we've studied in research trials and randomized controlled trials, showing that these are more effective than standard psychological approaches. So the emotional awareness and expression therapy is methods of taking feelings that may have been held in or unprocessed or avoided and letting them out in safe and healthy ways. So what did I do when I got back pain? The first thing I did was try to assess, was the pain due to a damage that I had, or was it due to the stress that I was going under from losing my job? I determined it was due to the stress. Then I started doing the pain reprocessing therapy. And what I did was I started telling myself I was okay. I was safe. I was not in danger. I kept telling myself, literally talking to myself, telling myself the pain is there, but it's not important. It's not relevant. It'll go away. I'm fine. I'm not in danger. I'm not afraid of it anymore. I'm going to keep walking. I'm going to keep moving. I'm not going to let it keep me lying in bed all day. And I started doing that for 1 week and for 2 weeks. And then I kept going and doing that. And the pain did not go away after 2 weeks. So I decided maybe I needed another form of therapy, the emotional awareness and expression therapy. Because what I was doing is I was telling people the hospital let me go. Isn't that funny? I'm a famous doctor. I've written books. I've done research. I've been there for 20 years. The hospital let me go. Isn't that funny? And after 2 weeks, I came to this realization. It wasn't funny at all. In fact, I was upset about it, but I didn't recognize those feelings of being upset. And the main feelings that I had were anger and sadness, hurt, right? So what I did was I was in my car that day when I recognized it's not funny. And I started swearing at the top of my lungs. I started yelling and screaming. Can I swear in front of you guys, or is that not allowed? It's okay. I'm just being real, okay? So I started screaming, fuck the hospital, fuck the insurance companies, fuck the doctors, fuck the medical system, fuck it, fuck it, fuck it. I was screaming all that, getting all that anger out of my system in what I would consider a safe and a healthy way, because no one heard me. And then I did something that I took to a higher level. And I imagined taking, you know how in Roadrunner, a cartoon where they have the plunger of the TNT? I imagined taking the plunger and blowing up the hospital. And I could just see the hospital blowing up into, smithereens. And if I had done that in real life, I would go to jail for a long time, rest of my life. But I didn't do it in real life. I just wanted to do it or I imagined doing it, right? And as soon as I did that, as soon as I blew up the hospital into smithereens, I took a deep breath and I relaxed. I let all the anger out and I let it go. Because hanging on to anger for a long time only activates your danger signal, makes your brain feel like you're in danger, which keeps pain going and going and going and going. Anyway, so I let all that anger out. I took a deep breath and I relaxed. And then I went to the other emotion that I had avoided, which was hurt and sadness. And I started feeling the hurt and the sadness of being let go. And I allowed myself to cry. And I allowed the feelings to come out. And it reminded me of times when I was hurt at other times in my life, when my father hit me with a belt when I was young. Not that he did that often, but he did. And the time when I lost my position on the starting basketball team, and one time when a girlfriend dumped me, and all these other hurts that I had had in my life. And I just let them be there, and I just let myself feel sad. And then I took that sadness and I turned it into compassion. Because if you're sad for a child, or if you're sad for a pet, or if you're sad for a friend, why would you be sad for them? Because you care about them. It's compassion. If you're sad, it's because you care. And if you're sad for yourself, it's because you care about yourself. So I took that sadness, instead of just wallowing in the sadness, I turned the sadness into compassion. And I started giving myself messages of kindness and caring and compassion. Literally talking to myself, you're going to be okay. You didn't do anything wrong. You'll get through this. You'll figure it out. You're a good person. And I happened to get a phone call from a friend who was very kind and caring, and he told me these same things. And then I got home. I was in my car. I had run an errand, stopped at the grocery store, and I got home. And I started walking into the house, and my pain completely disappeared at that moment. The back pain went away because the neural circuits that were causing it reversed, because the danger signal didn't have to keep going off, because I had let go of the anger, I had let go of the hurt, and I had moved to compassion. And the other thing I did is I forgave the hospital, because it turned out I have gratitude toward the hospital. Even though they got rid of me after 20 years, they put up with me for 20 years. And the reason they got rid of me was severe financial crisis, which is not their fault. And I never made any money for 20 years, because I don't make money for being a doctor by talking to people. Talking to people doesn't make money. Operating on people makes money. Injecting people makes money. Giving people pills maybe makes money, but talking to people definitely doesn't make money. And so they ended up, and it turned out they ended up doing me a favor, and I now have a practice that's only 1 day a week, which I'm very happy about. It's all virtual, and I can do my work, and I can have more time for research and teaching and speaking, which is what I'm doing right now. So that's what I know about pain. And it's not only pain that the brain can cause, it can cause insomnia, anxiety, depression, fatigue, brain fog, diarrhea, urinary frequency, ringing in the ears, dizziness. There's a whole host of things that the brain can cause that most doctors are unaware of. That's all I have to say.
Thank you. That was very interesting. I just wanted to let everybody know we have 3 minutes left until we move to the Zoom number 2, so we can have the doctor answer our questions and stuff. So I don't know if you guys wanted to ask 1 or 2 quick questions now, or before we get kicked out, or just move into Zoom number 2 just to be on the safe side.
Whatever the majority wants, I guess, or
I
the,
have to leave in a couple of minutes, so.
Oh, okay. That's okay. So whoever wants to answer some or ask questions, go ahead.
When you meet with somebody and you're going over their history and that kind of thing, is that the way you kind of come up with what they're exactly angry with, or is it just the history of what's gone on in their lives? Is that how you
Yeah.
determine?
Yeah, it takes a while to figure all that out, and sometimes you don't know exactly what was the thing. In this case, it was obvious. My hospital let me go, and I got back, and that's obvious. But sometimes it's just a buildup of a lot of things.
Mhm.
Yeah, you don't know. You don't always know exactly.
So you're screaming at a whole bunch of stuff then,
Sometimes.
and yelling. That seems
Sometimes.
like, I've seen those places where people can throw dishes and break stuff, to kind of get their anger out. I'm
Yeah.
sure it's therapeutic.
I don't think it's as good as screaming at the actual cause of the anger. Breaking dishes, the dishes didn't cause you the problem.
Yeah.
It's the person or the institution or whoever else it is. That's the problem. That's why doing it in your imagination is so effective.
Yeah, you just have to find a good place to go so nobody can see what you're or hear what you're yelling at.
You can do it. You can do it all in your mind. You don't even have to do it out loud. You can do it all in your imagination. All this is in my book, okay? Unlearn Your Pain. All of this material, all the pain reprocessing is there. All the emotional awareness, how to do it is all in my book.
Now you said you have a separate practice now. Do you see?
I see people now virtually. Unfortunately, it doesn't accept insurance, so it's very expensive.